Welcome back. In this section, let's look at connective tissue that's found in the skeletal system. So, in addition to the periosteum that I mentioned, which was dense, irregular connective tissue, we can also find fibrous or dense connective tissue that is dense, regular connective tissue in the forms of ligaments and tendons. So, to refresh your memory, a ligament is what is going to connect bone to bone, such as your anterior cruciate ligament, your medial collateral ligament, and tendons are what connect muscles to your bone. Also, the main type of connective tissue we have in our skeletal system are going to be cartilages. Now, remember, cartilage is connective tissue. So, what components must it have? All connective tissue made out of what two components? That's right, cells and extracellular matrix. So, in cartilage, we're going to take a prefix that means cartilage, which is chondro. So they're going to be called chondrocytes. And if you remember, we said they're always found in a space. And the name for the space is going to be the same as the name for the space in bone. So the chondrocytes are found in lacunae. Okay. And the matrix has two components, ground substance and protein fibers. And it's the type of protein fibers and the amounts of different types of protein fibers that will determine which of the three types of cartilage we have. Okay. So, lacunae with the E at the end is the plural form. Lacuna without the E is the name for one space. So, in this particular picture, the dot is the nucleus, then you can see the plasma membrane, then you see the little space, then you can see the lacuna. Most of the time, when you're looking at photomicrograph, you cannot see the plasma membrane. All you can see is the nucleus of the cell. And so when you see the nucleus, call that the cell. And whatever you see that's pale, call that the lacuna. Now, in cartilage, we cannot call the dense, irregular connective tissue periosteum because it's not bone. So we have to call it perichondrium, put in the prefix meaning cartilage. So all cartilage is going to be surrounded by perichondrium. And to refresh your memory, in cartilage, it's avascular, no blood vessels, and also no nerves. So if you tear it or damage it, it does not hurt. And that's a bad thing. So here were the same pictures I used previously to show you the three types of cartilage. Do you see the different chondrocytes with the lacunae surrounding them? Can you name the three types of cartilage? You remember the names of each of the three types? Okay, so here they are. Is that what you remembered? All right, let's go through these in a little bit more detail than we did when we were talking about connective tissue. So hyaline cartilage, when you're looking at this picture of hyaline cartilage, if you were looking at a piece, you would have perichondrium on the surface where you would have fibroblasts and fibrocytes. You have a lacunae in the center of which you are going to have a chondrocyte. And when we look at hyaline cartilage, it's firm, but it's flexible. It's glassy. It has lots of collagen in it, giving it some strength. And this is what we find at most of our articulations. So if we look at this, this is the back of your knee. And so your femur, your thigh bone is up here at the top. And this is your tibia. So all your weight is coming down on your femur, going to your tibia. So this is where your weight is being transferred. And so right here where you can see this smooth condyle, This is the articulating cartilage from your femur, which is hyaline cartilage. And this is for your tibia down below. Now, contrast that with fibrocartilage, which is the strongest because it has rows and rows of collagen. And if you have fibrocartilage at an articulation, this is an extra piece of cartilage. So what does that mean? It means at that articulation where you have a bone coming in, you still have your hyaline cartilage, and then you have a piece of fibrocartilage. And then the other bone has hyaline cartilage where there is that fibrocartilage. So you're going to have bone on both sides, articular cartilage, and then a piece of fibrocartilage. Okay. And so when we look at the fibrocartilage, we've got lots and lots of collagen. We've got our lacuna with our chondrocytes in it. And so classic examples where we see this, here's a vertebral body, there's another vertebral body, we would have articular cartilage here, we would have articular cartilage here, and now we have our intervertebral disc, which is a piece of fibrocartilage. Okay. In our knee area, we have a meniscus, which is a C-shaped piece of fibrocartilage, which is actually higher on the side and very thin in the middle. And that's because the top of the tibia is flat. And up here, your femur is rounded, and we don't want that round piece to be sliding off. So that's why it has an edge so it won't slide off. Your temporal mandibular joint also has, so there's other joints. It's more than just your knee and your intervertebral discs that have these pieces of fibrocartilage. So if we go back and we look at this, when I was showing you those pieces of hyaline cartilage, hopefully you were noticing that between those black arrows, you were saying to yourself, Dr. Pound, there's something between those black arrows, and I don't know what the hell it is. I don't know what it looks like. Maybe wadded up toilet paper. I don't know what it is. And you should have been making a note to write me a message asking me what it is. Because when you don't understand something and something doesn't look right to you, you need to be asking questions. And so what it is that is showing the lateral meniscus and the medial meniscus over here. And yeah, it's common for the medial meniscus to be worn down and be thinner than the lateral meniscus. Wear and tear on the medial meniscus. Okay, that brings us to the third type of cartilage, and that is elastic cartilage. Still has collagen, but it has lots and lots of elastic cartilage. And so we do an elastin stain. You can see all these squiggly little lines. We still have perichondrium. We still have chondrocytes in the little lacuna. The difference is the elastin makes it flexible. We've got 3 places in our body. We can bend this and it returns to its resting state. The 2 places that you know about are your 2 external ears. And the third place is going to be part of your respiratory system. It's this thing that looks like a wooden spoon known as the epiglottis. Do not have to know that term for this test. We'll have to learn it when we learn about the respiratory system. Okay, so that's it for this section. So thank you so much, and I will see you when we return. And next, we're going to be learning about bone formation, which is going to be the hardest of the 6 videos in this section. So make sure you're refreshed and ready to pay attention when you come back. Thank you so much for all your hard work.